Okay, good. Salam, hello. I'm so happy to be here and see you all. This is Fereshteh Ganjavi. I'm founder and director of Elena's Light. I'm former refugee and I'm from Afghanistan. It's my honor to be here today and talk with you about the work that we did during the COVID and after the COVID, and also the work that we do overall at Elena's Light. Elena's Light is a nonprofit organization in Connecticut. Throughout several programs and projects that we have, we are helping several refugee families here. I'm honored to have a great team working with us. And right now I'm talking about my journey. Myself as a refugee came with my mother in 2011 in New Haven area. When I came here, I didn't know any word of English that much, and I didn't know how to okay. No, no worry.
Can I log in here? Okay.
I think that is still working. You don't need to do.
It's working? Okay.
Maybe someone else signing to save an account and you don't need to.
Yeah, so we are sharing the screen, so we're good. This one. And presentation. Yeah. Okay.
Recording this?
Yes.
Okay, good. I didn't know many friends as I know right now, everyone's in this area. Okay, when we came here, I was able to ask questions, getting help. But there is many women in their community that we have, they are not able, they are most vulnerable people in this area. And I know my community more than everyone because I'm part of this refugee community. After I get my degree again and working at public health area several years, I was thinking now is the time to do a change. Change was to create a group of people to helping others. That's why we say women helping women. We create Elena's Light to support and help everyone at this in this area. Right now, I don't want to talk too much. We have a lot of great program and project, which Dr. Preethi and also Rachel are going to talk with you about all of the work in details. I'm gonna handle this from here to Dr. Preethi. Thank you so much for having us.
Okay. All right, thank you, Fereshteh. Good afternoon. So I will continue on to talk a little bit more about Elena's Light. So I'm going to highlight a little bit about Elena's Light and what we do. So Elena's Light is a refugee-led and women-led nonprofit organization right here in New Haven, Connecticut. And the strength of our organization lies in its visionary leader, Fereshteh, and our talented staff such as Rachel, and many volunteers. And our mission is to help build brighter futures for children, women, and women who are refugees. So in that context, we work hard to provide refugee families with all the tools they need to cultivate their individual independence. We envision a community that respects and celebrates diversity and provides equity of opportunity to all people. So in terms of why the refugee population, we work mainly with the refugee population here in the greater New Haven area. And just to remind you the definition, refugees are people who have fled war, violence, conflict, or persecution and have crossed an international border to find safety in another country. So United States has the largest resettlement program in the world. And we are known as a country where, people who have been persecuted have always been welcomed. Large number of refugee resettlement has been taking place, especially in the greater New Haven area. Now, if you look at these graphs, these actually show you the increase in the number of Afghani refugees who've been coming into the United States. Immigrant population, and then Afghani refugees in particular. And in recent years, especially 2021 to 22, there has been a significant increase due to the Afghan humanitarian crisis that's been taking place. When we think about refugees, they are a vulnerable population and they experience stress at various stages, including pre-migration, migration, and post-migration. So when we think of the refugee experience as such, there's a lot that they go through from being, having to flee their own home country to go to a foreign country that is completely new to them. And from previous trauma to post-traumatic stress disorder, and to integrating into a new society with loss of support and facing isolation, right? They do face severe risks as they face the risk of cultural stress, social marginalization, and other stresses that can lead to negative social, economic, and mental health outcomes. So COVID-19, it ravaged our lives. It presented for this population as a second trauma. So what it did was create more barriers. I'm sorry you can't see that part of the slide. It created more barriers to timely care and diagnosis, and also increased mental health risks. Thank you. Because of job insecurity, food insecurity, inability to socially distance, and fear and misinformation as well. Okay, so at Elena's Light, our focus is on refugee women and children, in particular because women are the primary caregivers in many households, and they're homebound, arriving in this new country, having to take care of multiple children, many of whom are disabled. So our focus is to provide refugee women and children equitable access to mental and behavioral health care because they face barriers related to language, acculturation, and financial insecurity. There's also many cultural and logistical barriers that they face, which prevent women from seeking education in the first place due to their unique situation. Just to give you a brief overview, what we do as an organization in New Haven, we provide personalized ESL lessons, and we also prepare women for their Connecticut driver's license examinations and help them prepare for the citizenship test as well. And over the course of about 5 years, we have had about 225 women go through these programs. Our health education, we try to provide high quality health education services to improve healthy lifestyle behaviors and also to bridge the gaps in access to care. So we partner with licensed healthcare professionals in our area and provide maternal and pediatric health education services. And during the pandemic especially, we worked to provide COVID health education. We ran multiple donation services, PPEs, and had vaccination clinics as well. So one thing to keep in mind again is we provide all these services to our clients at no cost at all to them. It's all borne by Elena's Light through donations and fundraising and through the countless hours that our volunteers put in. And within our community, we try to promote cultural understanding through cross-cultural friendships, like collaborating with our local universities, especially our students, and also providing a platform for sharing stories. We run a speaker series event, which runs multiple times a year. And these are ways that we try to engage with people in our own community so that they know how to integrate and be part of the society. So I think now I'm going to hand over this to Rachel. She's actually on Zoom and you can see her in the little corner there. So Rachel, take it away.
Thank you so much, Preethi. Hi, everyone. Now, excuse me. My role at Elena's Light allows me to wear many hats, and one of which includes working with some incredible community partners and researchers. Their contributions to Elena's Light allows us to access need and empower Muslim refugee women and families, even during a time of isolation and difficulty. Today, I'm going to speak upon a few different programs that we collaborated with our partners on and allowed to come to life and flourish even in times of COVID. Elena's Light overall is very proud of this model of service we were able to provide during the pandemic. It was really paramount to our vision in facilitating these resources to promote their overall well-being. So the first, I would like to highlight a study that has been done in partnership with the Yale School of Public Health. It was conducted by a researcher named Joseph Williams, along with his advisor, Dr. Kaveh Kushnud, and I acted as a head researcher at this project from Elena's Light. Elena's Light was able to provide the platform for the study to take place. And the findings of the study really provide us with a great bird's eye view of what was going on in the refugees' homes at this time and some of the challenges that they were facing, especially as we emerge out of the pandemic. And please feel free to hover a camera over the QR code if you would like to contact the researcher himself. You can go next. So this retrospective mixed methods design study was implemented between October 2021 and January of this year. 10 families from Elena's Light participated in the study, and surveys were administered through mothers verbally over the phone on a one-time call. And they were asked to retrospectively think back to pre-COVID and during COVID-19 emotions and behaviors of their children, ages 4 through 15. This information was gathered through a strengths and difficulties questionnaire, as well as some qualitative questioning. You can go next. Here we can see some of the researchers' major findings and analysis, which include discoveries in the areas of nutrition, depression, and development for these refugee children. As you can see, in terms of the nutrition, some mothers noted changes in weight for their children due to a lack of physical exercise that was once provided at schools, and also limited mobility while staying at home for online schooling. In addition, it was also noted how children's time away from the normal school environment and their peers has been associated with an increased risk in depression, anxiety, and somatic stress. That was relevant for the study as well. It was also found that these children were no longer participating in any extracurricular activities that were being offered due to fear of COVID-19, which could impact their developmental growth. You can go next. So these are some quotes from the mothers in the study. The first one read, "He got small in his face and his body because he was so sad. He had fear of getting COVID-19. He was not eating too much because he was not active. 2 times a day. He was not eating much. It was bad." And the second one touches upon the refugee children's experience during COVID and the lack of exercise and emotional toll that can take, noting how, yes, she was small, she was not active. They feel like they are not free. They feel like they are in jail. Can go to the next one. So this data came from the study, and what we're looking at here is a baseline of what our sample size was at before the pandemic. So the blue shows that the children's emotions, behavior, and conduct before COVID was close to average. And we can see that the emotional and hyperactivity problems for refugee children, again in blue, mirrored the national population. They were not at risk. We can see a bit of risk in the conduct problems as seen in the orange on the center bar, but it was not a statistically significant difference. It's also important to note that the conduct and emotional problems are internally valid, and they represent the strengths and difficulties questionnaire. So now if we compare this to during COVID, the close to average scores that are represented in blue decrease, and we can see a very high risk for kids across all dimensions as seen by the gray, yellow, and orange across the top of the bars. Also, we can see a statistically significant difference when you compare the national data to the self-reported pre-COVID data. This research shows that we have evidence to support that COVID has increased risk for all 3 problems: emotional, conduct, and hyperactivity. Overall, the research was able to find that COVID had a negative impact on the mental health of refugees, and it resulted in emotional and conductive problems, which could lead to further mental health difficulties down the road, such as anxiety or depression. Lastly, I just wanted to note there is a possibility of reporting bias, especially when it comes to the hyperactivity problems. We're actually more likely to see higher rates than what was reported. You can go to the next one. Okay, so the next program I wanted to touch upon is our summer wellness program. It's called, even during the pandemic, Elena's Light really intensified our advocacy efforts in the health and wellness sector. And this included our work to put on a summer program to help refugee children when they needed it most and where they needed it most. And we brought it right to their back door. The program is called Empower. It's the emotions program outside the clinic with wellness education for refugees. And it is the heart and soul behind our summer program. It is a culturally informed, innovative health education and prevention program put together by the minds of Dr. Julia Rosenberg and Dr. Tricia McDonough-Ryan, a pediatric neuropsychologist. The QR code on the screen links directly to their manual and their website if you have any more information. Okay, can go to the next slide. This gives us some background on Empower. The desire to create a program like this was due to the fact that refugee children are less likely than their non-refugee peers to receive diagnosis and care. So we wanted to overcome those barriers with a social emotional learning curriculum. We wanted to break down all these barriers such as transportation, large families that would arrive with their little ones in tow, and language barriers and trust. So because of Elena's like position in the community and, people such as Fereshteh Ganjavi, we were able to gain that trust and put on the program. You can go to the next slide. These are just some photos of our program that happened last summer. It was our second annual Children's Summer Program. Like I said, we brought it right to the refugees' homes outside the apartment complexes that they lived at. And together in family units, they played their way through a curriculum that involved coping skills, emotions, sleep, and more. Go to the next one. And these are just some quotes from the program. It had a wonderful impact on the community. Next, these are some quick little overview of the materials shown. And the last point I want to touch upon are our collaboration with Y-Healer. We really prioritize these network buildings, and Y-Healer builds right into that goal. The QR code on the screen links right to their website with any more information, but very briefly, it's a family-based interactive pediatric healthcare curriculum that was created with the goal of increasing childhood health knowledge among our families. We have a health class about once a month, and it's been shown to have great results. Due to a recent study, 100% of participants would attend again and recommend the class. So we're happy for that collaboration. I'll hand it back to Preethi.
Thank you, Rachel. So, that was a very brief and quick overview, but looking ahead, we have some special activities in mind, and we hope to implement that soon. We are really excited to partner with Southern Connecticut State University as they host their first Fulbright Scholar in Residence, Dr. Ayad Nashwan from Jordan, and we will work in collaboration with Dr. Amy Smoyer at the social work department at the university. And the whole idea is to do some participatory action research project. And again, the idea is to develop faculty and staff capacity to provide social and mental support to Muslim, immigrant, and student communities. We already have started on the legal advocacy program, which really took off in response to the Afghan crisis. We have local legal teams working with these populations here and there to kind of get things moving on their side. And lastly, we are also hoping to have an Afghan women's conference. It's in the works, and hopefully in the recent future, we will have that as well. Of course, none of this would have been possible without, the support. We're really proud and happy to have this support from all our local partners, both in Connecticut and also in state and out of state. There's always room for more collaborations and partnerships and funding. We really do need a lot of funding as well. So if you would love to work with us in any capacity, please do speak with us, and we can get some things in action. And finally, we want to thank all our researchers who and program partners who shared their work with us, and to the Muslim Mental Health Community Conference organizers for including us in this wonderful conference. Thank you once again from the team at Elena's Light. And if you have any questions, we'll answer them after the presentations. Thank you again.
Shahd and Hala. And yes, we're currently first-year master's students, but in our undergraduate degree at the University of Toronto, we pursued a summer research project exploring whether belongingness can protect against the development of symptoms of mental illness among Uyghur migrants and refugees. So to preface the content of this presentation, we just wanted to take a minute to highlight some of the language we will be using. So you'll notice that you'll hear us say East Turkestan as opposed to Xinjiang to refer to the region where Uyghurs are migrating from. The reason is because we want to bring the voices of the Uyghur people in this presentation. And our research with this community has taught us that the preferred term used by the Uyghurs to refer to their homeland is East Turkestan rather than Xinjiang. And many of you may have heard about the crisis going on with our Uyghur Muslim brothers and sisters. But for those who may not have had the chance to learn about the issue, the Uyghurs are a Muslim Turkic heritage group, mostly residing in East Turkestan, which is in northwestern China. And there has been conflict in this region for decades, but the most recent one has led to a significant increase in the migration of Uyghurs from East Turkestan to various regions around the world. And this migration happened because of the most recent crackdown of the Chinese government on local Uyghurs in East Turkestan, where officials detained Uyghur men and women to re-educate them, increased surveillance on the group, and limited their ability to express their cultural traditions and religious acts of worship. So this crackdown has led to the migration of Uyghurs to places all around the world. And what we noticed from emerging news reports is that Uyghurs who have resettled in countries across Europe, North America, and other regions are actually facing unreported distress, depression, and PTSD. And this is concerning from the lens of migrant resettlement and mental well-being. So we decided to look at the literature on the health and well-being of refugees and immigrants. And one theme that emerged is feelings of belonging. Specifically, sense of belonging to one's host country was seen as a protective factor against mental illness and distress.
Sorry about that. Hala and Shahd, can you please unmute yourselves?
Hi. Yes.
Yeah, thank you. Sorry about that. Go ahead.
Can you hear us now?
Yes, we can.
Awesome. Okay. So just to recap what I was saying, specifically, sense of belonging to one's host country was seen as a protective factor against symptoms of mental distress. And this happens because it enhances the individual's sense of identity and belonging to society, and consequently improves the coping behaviors that individuals might have during times of distress. It is estimated today that 1 to 2 million Uyghurs are detained in concentration camps. And reports are also suggesting that Uyghurs are being heavily surveyed, subjected to illegal organ harvesting, and restricted from practicing their culture and religion. So we hope this highlights the gravity of the issue that we're discussing today. And part of the goals of the study is to increase awareness about the topic in spaces like academia, where unfortunately the topic is rarely discussed or addressed.
So what is belongingness? To belong is to feel like you are accepted. Many psychology studies emphasize that the human need to belong is an important ingredient for happiness and flourishing. Basic psychological needs can be met through belongingness, where a sense of belonging is marked by a strong loyalty and connection to a specific group or place. Unfortunately, refugees are at risk of feeling excluded from society. Research shows that refugees are more vulnerable to developing mental illness due to factors like loneliness, discrimination, and previous and secondhand trauma. Belongingness has been shown to encourage coping mechanisms for negative experiences. For example, in vulnerable groups in the Gaza Strip and Syrian refugees. However, a limitation of these studies is that they assessed general belongingness to the participants' heritage culture, for example, Syrians belonging to Syria, and not to the receiving or host culture, for example, Syrians belongingness to Turkish hosts. Therefore, our research question is, can a sense of belonging actually protect Uyghur refugees from symptoms of depression, PTSD, and mental distress? We predicted that yes, the stronger the sense of belonging, the lower levels of depressive symptoms, PTSD symptoms, and mental distress.
So before we highlight the methodology that we used in the study, here are the list of terms that we used and the way that we operationalized them. So we measured a sense of belonging using the general belongingness scale, and we adapted it specifically so participants can understand it as belonging to one's host country. And host country was defined as the country that they resettled in. So the Uyghur migrants have resettled in that host country. PTSD symptoms was assessed using the PTSD symptom scale. Distress or mental distress was assessed using Kessler's psychological distress scale. And depressive symptoms were assessed using the Center for Epidemiological Studies depression scale.
We investigated our research question by conducting a mixed methods approach using both quantitative and qualitative measures. Our quantitative portion was conducted through an online questionnaire, which included 4 scales: the General Belongingness Scale, the Center for Epidemiological Studies Depression Scale, the Post-Traumatic Symptom Scale, and the Kessler Psychological Distress Scale. These scales were chosen based on preliminary findings about the most concerning areas in the psychological well-being of Uyghur diaspora communities. Some items of each scale have also been adapted using the input from and consultation with Uyghur community members. The questionnaire was circulated with the help of Dharman Foundation, a nonprofit Uyghur organization in Canada, as well as with the support of community-recognized Uyghur members across the United States, Canada, Turkey, Germany, and Australia. Our target was to reach a sample size of 100 participants and to then use Pearson's correlation to run our analyses. Here are some sample adapted items from each of our scales. We try to keep the context of the item specific within the host country or East Turkestan and use terminology and phrases our sample of participants would recognize to effectively answer our research question. For example, in the general belongingness scale, we adapted "I feel as if people do not care about me" to "I feel as if people in my host country do not care about me." As for the CESD scale, we adapted "I felt that I could not shake off the blues even with the help from my family or friends" to "I felt that I could not shake off the sadness even with the help from my family or friends." And in the PTSD symptom scale, we adapted "trying to avoid activities or people that remind you of the traumatic event" to "have you been avoiding doing things or going into situations which remind you of the events in East Turkestan." As for our qualitative methodology, we developed a semi-structured interview schedule to delve deeper into the unique circumstances of each interviewee. Our questions focused on the participants' sense of belonging and disbelonging, the challenges they face in their respective host countries, the sources of support they can access, as well as opportunities for improving their sense of belonging in their host country. Our target was to recruit 8 to 10 interviewees and for each interview to last about 30 to 45 minutes. Interviews were audio recorded and transcribed, and then an inductive thematic analysis by Brown and Clark was conducted to code and interpret the data. As for our data management plan, all questionnaire and interview data were stored in an encrypted password-protected file. Our questionnaire did not include any identifiable information, and our original audio files were destroyed as soon as transcripts and notes were finalized. As for ethical considerations for interviewees, the research did not involve risks beyond those normally encountered by the participants in their life outside of research. However, given that they are a vulnerable population, we mitigated the risk of being identifiable and exposed by the Chinese government by using online platforms they felt comfortable using, such as Zoom and WebEx. As for informed consent, we obtained digital signatures from participants on a consent form, which are also stored securely. We also got their verbal consent on the day of the interview. And as part of the debrief, participants were also offered to be referred to the appropriate mental health resources if the discussion caused them any distress. And lastly, as for the respondents of the survey, informed consent was provided at the beginning of the questionnaire. So this is an overview of the profile of our participants in each section. So as you can see, we reached our target sample size in the quantitative section, as well as the qualitative section. Moving on to our quantitative results, we plotted all participants' scores from the 4 scales. Our independent variable was belongingness on the x-axis, and our dependent variables were depression, PTSD, and distress on the y-axis. After running a correlation, we found a negative relationship between belongingness and all 3 scales. In other words, a higher sense of belonging indicated lower PTSD symptoms, lower incidences of depressive symptoms, and lower symptoms of mental distress. This means that if a person feels more belongingness towards their host country, the less likely he or she would develop symptoms of mental illness. We also found that based on those who scored on the high percentile range of each scale, 68% experienced high levels of depressive symptoms, 71% experienced high levels of PTSD symptoms, and 63% experienced symptoms of severe mental disorder.
Thank you so much, Hadia. So as we mentioned, we used an inductive approach in our thematic analysis. From our interviews with our participants, we extracted the themes that emerged from their dialogue, and we used those themes to identify the specific challenges that Uyghurs are facing so that policymakers and stakeholders who are working with this group can easily find areas of intervention. We also were curious about the supports that this population receives, so that we can translate them into potential recommendations that can be adapted for improving the mental well-being and belonging for this group. So some of the challenges included language barriers, where Uyghurs who are resettled in different countries are finding it difficult to learn and speak the local language of the host country. Cyber attacks are continuing to occur to resettled Uyghurs, and this happens in the form of unsolicited phone calls from the Chinese government, in which the government agents threaten their family members back home. There's also heavy censorship. Hardly anyone is able to obtain any information about the Uyghur crisis, but this is especially difficult for Uyghurs who are trying to just simply connect with their family back home. Many of them do not know if their family is alive or dead, detained or free. And along the same lines, another theme that emerged is uncertainty about loved ones. And we noticed that academics commented on the idea that uncertainty about loved ones seems to be a condition that is unique to this group, since no other refugee group suffers from the heavy censorship from their local government on the same scale as Uyghurs in East Turkestan. There's also lots of guilt and stress about being the ones that survived the suffering from living in East Turkestan under the oppressive regime. There's lots of urgency and motivation to help family members back home, but they often feel helpless against the forces that are beyond their control. On the other hand, there are also sources of support that Uyghurs are accessing during times of stress. This includes freedom of expression. So living in a country that promotes freedom and that allows them to express their identity and their religion fully has been mentioned as a great source of appreciation. Political support was also important. So when the host country condemned the actions of the Chinese government against the Uyghurs, the Muslim Uyghurs in that host country felt a great sense of belonging. Along the same lines, being able to have symbols of belonging such as citizenship to the host country has also been a great source of support. Faith and religion have also been mentioned as bringing a sense of peace and relief during times of uncertainty and distress. And some even mentioned being in therapy as a source of healing and recovering from their pain. There is one quote that we wanted to share with you from our interviews. Until today, I have no confirmed information where my father died and under which circumstances. I lost contact with my family for more than 20 years because I did not want to endanger their lives. Almost everyone in the Uyghur community has loved ones who got detained or lost. And this was said by an Uyghur man living in Germany. As for our next steps in this research, inshallah, one thing we want to look at is if increased sense of belonging is associated with higher levels of well-being. So since we only looked at the negative aspect of this condition, so we only looked at symptoms of mental illness, we hope that in our next study, we're able to also look at the positive aspect and the things that are contributing to higher levels of well-being. We also want to explore ways of promoting psychological well-being among Uyghurs and similar refugee populations, and we hope to do that by looking at existing interventions and assessing their success within the Uyghur communities across the world. We also want to look at how uncertainty about loved ones is related to symptoms of mental illness. As you mentioned, this appears to be something that is unique to this group, and so we hope that researching into this can help us identify ways of helping our Uyghur communities. And before we leave you off, we also wanted to give you all a chance to be able to contribute and help address this issue. So one thing that you can do is educating yourself about the topic as well as those around you. As you're currently seeing, there is deafening silence about the Uyghur crisis and what's happening in East Turkestan. So by doing your role to educate yourself and those around you, inshallah, you'll be part of raising awareness about this issue. Also signing local petitions, so finding petitions near you, maybe located in the United States or wherever you're joining us today from, in order to make sure that the Chinese government is held accountable for the crimes against the Uyghur communities. as well as boycotting companies who are benefiting from the forced labor of Uyghurs in concentration camps. And feel free to screenshot the slide or take a picture of it if you'd like, because these lists have the updated companies of the ones that are benefiting from forced labor.
And with that, thank you so much for listening to our presentation today. We hope you found it beneficial. And if you have any questions or feedback, we would be happy to attend to them over email or over the conference app.
Thank you so much. That was a great presentation. I appreciate it. Okay, thank you. For those of you who are joining a little bit in the middle of this, we have one more presentation left, and then we have a discussant session with the Q&A, leading the Q&A to follow. And next topic is open the presentation. Our next presenter is Hadia Zarzour, and she is going to present on Syrian refugee children. We are just, Hadia Zarzour is a licensed clinical professional counselor who came to US in 2009 on a Fulbright scholarship to pursue her master's in community counseling at Loyola University. Since then, she has been working with refugees, and she is also certified in global refugee trauma from Harvard University. In 2020, she started working her private practice, Healing Zone, and since then she's been working with adults, teenagers, and families. So welcome.
I don't. What do I have to do?
I don't think nothing.
Assalamu alaikum wa rahmatullah. It's so good to be here. It's actually, it's always painful to sit and listen, but it's also motivating, inshallah, that we can all collaborate and work together on our programs and initiatives that we're invested in. So as mentioned, it was mentioned in the first presentation, the idea of telling a story, and telling a story is a way or a tool that we use for healing and coping with stress. So I'm going to share some of the part of my story. As I came here as a student, I was very excited to finish my program in counseling psychology. I used to teach actually at a private university in Syria, and I was so much ready to go and establish a counseling center there. And that same month, actually, the revolution started. I used to be an intern at an Asian Human Services, which is a community mental health agency. That we have like a very diverse staff, and I worked with refugees who are from different backgrounds: Vietnamese, Cambodians, Chinese, Bosnians, Iraqis. It was an amazing experience, but I kind of like, I wasn't very happy in terms of like, what am I going to do when I go back home? I want to be a therapist as an educational institution. Then the revolution started. It was so dangerous to go back home. There was a lot of guilt about this decision, as it was mentioned, when people decide to make a decision of like, what am I supposed to go to do, or like go back or stay here away from my friends and family, with also the skills that I gained as a therapist. I decided to stay. This is how my country looked like. I haven't been. This is still really very painful for me to see. This is here a very, very significant experience in my work. As Syrian refugees in 2015 started to take the boats, and many of them we heard over the news about a lot of deaths because they couldn't get to Europe. I used to think that I was really, when you start being a therapist and you would think that you're a good therapist, you think like you will know it all and you wouldn't be in the field unless you really care about people. I still think I cared about people, but I was actually, this incident here, this news about people taking the boats actually made me face my biases and made me face really what I really think about people. It's not easy to say that, but it was an eye-opening experience, because when you hear about refugees and you work with them, there is another layer of you think, at least for me, I just feel like as if they are the other. Unfortunately, I didn't know that working with them, but that feeling I had when Syrians became refugees, I just felt like it was too painful. And it was like, how could you explain to people that, no, they're not to look to them and treat them from this deficit lens, from only traumatic lens. So I decided because of that. And again, here, this picture, my clients used to tell me about their experience in the 70s, especially the Vietnamese clients, taking the boats to come to Boston. So it was like it was an eye-opening experience. And I decided to become an advocate to talk about, not only, we're all advocates for mental health. Alhamdulillah for that, but also this is another layer of stigma and another layer of work and advocacy of saying that those refugees are human beings and they have needs, and actually they wouldn't be refugees if they didn't face war. Many of things that here, I'm just gonna skip through them because they were mentioned. That's the advantage of having people who speak about similar things before you. So the model when we think about working with refugees was also not the same one that I learned when I went to graduate school, and that's always a message that needs to be emphasized. We're not really going to sit in our room and just what we imagine. That's what I wanted to do, just to sit and you ask about your trauma story. You will expect the client to share with you. Actually, with refugees, it was completely like going to them from the back door, as they say. So we start with a case management model, and starting from according to Maslow hierarchy of needs. What do they need? I did a lot of home visits. Also, I wasn't very happy about that because it was strange to me. It's not getting out of your comfort zone to go to people's homes and listen to them and eat their food, like taking them to doctors, going to schools to talk about the background of the students, that he's a refugee, his parents maybe don't understand the language and they need extra support. It doesn't mean that they don't understand. They just don't know the language, and that's a huge difference. And I could see with teachers when I meet with them, the idea when they say, oh, refugees, so refugee camps, and I'll be like, no, not refugee camps, because that's another stigmatized layers of having a refugee. So this is what I learned back then about this social ecological model of approaching trauma, and how everything is really interconnected. You could see that from Elena's slide and the work that they did when they talked about engaging peer groups, engaging the neighborhoods, talking about the culture. It's not only about the individual. Psychoeducation also is a big one. As I said, I'm going to just skip through them. This is Dr. Stan McCracken. He's my mentor. I always mention him because he gave me a lot of hope. And when you spoke about belonging, sometimes one person can help you feel that you belong to this place, because he told me about like this role that I can play as Syrians are coming here to Chicago. For 4 years, I worked at that agency with before Syrians became refugees. So 4 years of working with different refugee groups. And then he told me, maybe all of this work will really prepare you to work with Syrian refugees and help them here. And he talked about post-traumatic growth. He introduced this to me, and how with support we can help people bounce forward when we give them the support that they need. So they become stronger because of their experience, this very difficult experience and traumatic experience that they went through. And that's a very important approach, because as therapists, when we think about, again, the idea of like refugees equals PTSD, which is not accurate at all. You know, like you're coming into to the session and you're thinking that this person is like, oh my God, he has all of those symptoms, versus thinking about the story of like, okay, what are the source of hope and strengths for this person? What can I ask about their story that I can learn about what got them to come here and to start a new life and keep feeling hopeful. So when we talk about post-traumatic growth or trauma, I always like to think about hope and to think about people's resilience and what helps with that. Legal status is so important. What we need to know here, there's a lot of research about that and how legal, it's connected. Legal status connects to the idea of belonging, and it affects the care, the access to care and access to schools. Another big factor for resilience is religion, and in the programs that I work with, especially overseas, there we focus on the spiritual support and the religion, the faith aspect, because the idea of like Allah is in control, the idea of there's fate, the idea that I worked with a psychiatrist who's Syrian Christian, who wrote an article, he called it Alhamd culture. So he worked with a lot of Syrians in Lebanon, and he said, it's amazing in your faith. So he grew up in Damascus. He's very familiar with the Islamic culture. And he said, there's this hadith that if something wrong happened to the mu'min, to the believer, then they feel like, it's good for them. And if they're patient and they feel like, it's from Allah. And if there's something good happened, then they thank Allah and they also feel good about it. So that's very good for and research supports the idea of having faith as a very crucial factor for resilience. We talked before and as mentioned from my colleagues about the, supports. And from that, we design our programs of what kind of support can people have. We talk advocacy when it comes to discrimination and racism, and that can be in school, where it doesn't mean that we go only on media and talk to congressmen about that. It's actually the idea of what do we have in schools, in our neighborhoods. Like in Chicago, there are neighborhoods that I know for sure that they wouldn't really receive refugees, or they wouldn't have welcoming centers as other neighborhoods. So it's interesting to learn about that. We talked about labeling the trauma story, how we not to focus on the trauma versus the strengths, and also, of course, cultural competency, training people to be culturally competent and not to fuse everybody together. I used to do that. When they tell me refugees, I'll be like, yeah, I was really ignorant. But now I learned that we need to know the social and political aspects beyond a story. Like for me, when you talk about Syria, and people say, oh, refugees, it's civil war. And I'll be like, no, it started as a beautiful, honorable revolution. People took it to the streets under this dictatorship. It's amazing. So you speak, when you want to treat them, actually, you speak to their values, the values of freedom and dignity and sacrifice. You can't just say civil war as if we're kind of like the other person will shut down. Okay, civil war, may God help you. So it's very important to know the story and really listen, not to think of what you know versus listening really very carefully and attentively to what the person is trying to tell you. So where do we start? We're talking about engaging neighborhoods, engaging schools, engaging organizations, community leaders, faith leaders. The first thing, how to have agency. Actually, I did this as was mentioned, the Harvard program for refugee trauma. They said that there are social instruments for healing are school, as you might imagine, work and spirituality, and community healing versus individual. And the good thing about having a community, sometimes it's sad when you feel like we have millions of people who went through the same thing. But the power in that is that they understand, they can learn from each other. It's not only me who I went through this trauma that I'm, isolated by it. It's actually it's actually big numbers of people, and that can be also empowering. So we started in Chicago in 2016. There was, after the Trump administration was elected, we focused on being on trauma-informed schools. Of course, that was before, but this specifically for refugees. I worked on with the training team at Lurie Children's Hospital that's connected to Northwestern University, and we had this initiative. We trained almost 1,000 people who were like educators and doctors and social workers, basically. And we have a paper about that was published last year, if someone wants to look at it. I just put them here just to give you an idea. I'm not going to go through the training, of course, but it was focused on what is trauma, what are the reactions to trauma, and how does that manifest in classrooms, and what do we mean by different terms when we think about legal status, because people have, when they're refugees, I would say they're 100% legal, and you could see how people are open to help those refugees just because of the fact that they're legal. Even with teachers, you say refugees and you see this look on their face, and I'll be like, they came through UNHCR, they're going to get a green card in less than a year. They're absolutely legal, and you see people how they're kind of more open for helping. So it's all about, again, educating and giving this knowledge. So also with those teachers training, we talk about that, the difference in terminology. We also talk about, as it was mentioned in the talk before me, like the idea of multiple sources of trauma. We have not only when they fled their country, it's also flight and resettlement. People think that they're here, so everything is okay. Well, actually, they really need support. So when they come here, we look at adjustment. I encourage you to look at this very short video online about how this is the first family that came to Chicago in the end of 2014 that I closely worked with. Now, this girl used to say the only thing that made me go to school is just because my teacher would smile every single day, and she would do this to me to encourage me to smile. She didn't understand any English. She was 7 when she came here. Now it's been a while, so she's doing very well. We should do another video. This was mentioned, the idea of guilt, the resettlement trauma. I'm going to skip. In this training, trainings that we gave, we also talk about family dynamics and the idea of how, roles are shifted. So we need to support parents. Another initiative that stemmed from that, more focused program. Actually, I presented on that at this conference 2 years ago. So maybe you can look at the presentation. But the idea of we really have initiatives. We have programs. So this is support group, 10 sessions. We train teachers and facilitators, and it's really based on giving those students coping skills and building relationships. It was built for Syrian refugees. We started right before COVID, and we started in Canada, and then it's now being facilitated in Chicago and New York and Boston. So I'm on the training team and the research team for that. We're still working on we haven't published any papers in Chicago. So also we talk about the journey. It's manual, very clearly this detailed, beautifully detailed manual that helps facilitators. And also, so also in Chicago, I co-founded Syrian Community Network. We had the mentorship program, which we were, we had over 100 volunteers who we pair them with families. So that was also very powerful because it really increased the self of belonging. They feel like they have, this American family is visiting the Syrian family and learning from them, so they help them feel adjusted. If we go now internationally, two initiatives or programs that I really am very proud to be part of. We started actually in 2012, لأنك إنسان. So in Arabic, because you're human, we called it Insan for psychosocial support. Those support groups, one of the things actually that was mentioned in a previous slide, the idea of social comparisons as one factors of resilience, but social comparison that's downward. And I used to go to Turkey, and I was sitting with a group of women, and one of them, so what that means is that they feel sometimes shy to say, oh, I lost only one, how come I have all of this pain and I lost only one child, when other people lost 2 or 3. This woman said that to me directly. So the idea, this helps them really feel that, yeah, others, some people will tell me, at least we didn't lose any person. Oh, your house is being destroyed. Alhamdulillah, we didn't lose anyone. So this also, it's very empowering. It's amazing when you hear this. So for لأنك إنسان, again, we've been around for 10 years almost, from the very beginning. We do, we ask, when you ask children to draw, that's what you see, and that also manifests in behavior when children are becoming very aggressive and violent themselves, and then they don't trust the authority, of course. So you could imagine, and being without school for so long, many of the children, they didn't have schooling in Lebanon or Jordan or Turkey because they don't have legal status. So it's different when it comes, when we talk about the US. And alhamdulillah, like it's way, I mean, it's still very difficult, but compared to overseas, there's a huge difference. I love this picture, how this boy has learned how to breathe deeply. So we have many programs. Usually it's like 12 to 15 sessions. Each session is an hour and a half. We are identifying feelings, stress management, coping with loss, the 12-step program. I'm going to talk about it in a minute, and child abuse for the children and for the teachers and for the parents. And we do training workshops for people who would like to support, because we know we don't have a lot of therapists. So we're working on capacity building and people who have some psychology background, and we train them on those very specific programs that we have. And we have theater. I love theater, as you might imagine. I would love to act. So they're acting without me in Turkey. What we're asking them to kind of think about their stories and to act it out. And you can imagine with theater how powerful it is to focus on values, that they have. Bullying is a huge thing. So we use also the puppets theater for that. These are the different, we have the loss also program, maybe I mentioned, and that's some of the theater pictures. Well, and it's good that they target thousands of people with the theater, and even their families feel really engaged. And what's beautiful is that this is all like really personal. It starts with personal efforts, people reaching out to schools, and those schools, they're not the regular one. Those schools that are only opened by like UN, or sometimes even people with the last initiative that I'm going to talk about, actually people are intense. So it's really very miserable situations, but still the teachers are saying that because of those programs, they see that students are more focused, and you see less violence, and they're more engaged, and they're able to express their feelings. And as you say, they were practicing even breathing and trying to cope with their emotions. So what also the app. The app actually it came out right before COVID. I was honored to use this app. Anyone can download this app. I really invite you to download it. We're still working on the English version. I presented a poster on it also in the last conference. So it's based on the 12-step program that's basically for addiction, but this one is for the trauma one. We tweaked it a little bit. We added a spiritual component. And in all our programs, we always add like a spiritual component to any step that we're giving. So there were like a group of women, 64 women in 5 WhatsApp groups that they were under the bombings. That was like 2 years ago. And I will check with them. So we trained them before they had this, like they were in the basements. We were teaching them about the 12 steps and how they work, and when the bombings started and they went to the basements, we were able to do some work with them. And I remember, because of the different time zone, I was able to work with them when others were asleep, right? And they're awake at night. And they would tell me again, like when I say, how are you? They say, we're so happy to have you to check on us. And again, alhamdulillah, everything is destroyed, but nobody died. And we remind them of those steps. Please take a look at it. It's called Psychological Lifeline. We did also just a pilot study on it that you can also look at. The last thing I want to say, لأنك إنسان collaborates with many initiatives, and this is the last one I'm going to mention. It's Abjad for education. It's inside Syria. Now, Lianna Kansan works in Turkey, Lebanon, Egypt, and also part of Syria, but mostly Turkey, Lebanon, and Egypt. For Abjad, they're only inside Syria. I talked to one of the person who was the head of the teachers yesterday, just because I wanted to talk to you fresh. I was like, okay, just tell me, give me a summary. And she said all of those students are in tents. We go to their home, to their parents in the tents. You know, when you say tent, this is Syria. Like it's really something odd to say that people till now are in tents. La hawla wa la quwwata illa billah. These are the teachers. So, and they encourage them to bring their students. There is no regular education. They came up with a curriculum themselves. How does the Anna Kansan help? With training, with supporting and training the teachers. So they bring us cases, mostly violent cases, and we try to help them, and we try to support the teachers themselves. And now she's saying people are coming. The violence has been less, and they keep, and even the staff would go and visit the families every month to tell them you need to educate the kids, because mostly they got married. She said like 12 and 13. There are some cases, as you might know, and also because they help their parents as younger age for extra income. So, I mean, thank you so much. I hope we can collaborate. It's an honor to talk about those initiatives, because these are the people who give me really the strength by their resilience to keep going. So inshallah, we'll be able to work together and collaborate. And thank you so much, Dr. Farha, for all your support.
This is the last.
Yeah, this last.
So, I'll just ask you to brief, and then we can do the questions.
Okay. So I'd like to introduce you to our discussant for today, Dr. Farha Abbasi.
That's okay.
Okay, well, she's very humble, doesn't want to be introduced, but just so you know, she is the founder of this great conference that you're attending, the annual Muslim Mental Health Conference.
So, alhamdulillah, right? Hadia, thank you. It was personally very inspiring to hear that your journey has been through the conferences as well. And I love it when you come back, and I love most of you keep coming back. But so I think it was the second or third year of the conference that I made the commitment to have a refugee panel in every conference, because I realized that the more research and work, global work that I was doing, that currently, even if we look at the major conflicts of the world, they are either in Muslim majority countries or are impacting directly or indirectly impacting Muslims. So any given day, there are more Muslim being displaced, disrupted, destroyed, or killed. So when we talk about the war on terrorism, there is more Muslims dying every day on hands of terrorists, right? So that's one thing that is we need to keep the focus on. Other thing, what I realized is when we talk of this, be it internally displaced, evacuees or refugees, asylum seekers, what I think we are missing is the children. That majority of these refugees, and it's very hard. So we just completed a conference at Michigan State. It was my proposal that this state of belonging nowhere, how is it going to impact the Muslims? Because I think we have a whole Muslim generation growing up that will not belong to any country. And we are not thinking ahead. So on one hand, we have that issue, but on the other hand, what we see is that in our culture, fostering is a new concept. So we are still coming to terms with and developing these networks to help these children. What we realize as mental health providers, social workers, that this trauma of not belonging or not feeling secure or not having predictability in your life, the early exposure, the
if the exposure to trauma, if it's early on, it will have more detrimental impact. So one study here, which is Adverse Childhood Experiences Survey. Yeah. So Adverse Childhood Experience Survey that was done here in children here, not refugee children or asylum seeker or anything like that. What we found out in that survey, it's 1 to 10 question survey, right? And what we saw that if you scored 6 or 7 on that survey, so it could be exposure to violence, displacement, losing a primary caregiver, divorce of the parents, exposure to war. If you are scoring up to 6 on that, then your lifespan can be pre-shortened by 10 to 15 years. And those studies are not replicated in what we know, kids living in tents. Another thing that really broke my heart, that research that I was doing for my other conference. So by rough estimate, 40% are children, 40 to 50% are 50% or higher are the children. But there is one child that die every day in these camps, either due to starvation, disease, or they go missing. And we have no idea about the extent of the trauma, right? But that said and done, I am an optimistic person. I think these conversations help, because this then lead to collaborations, and we need to keep on thinking about the post-traumatic growth. So the trauma might happen in Syria, Uyghur, China, East Turkestan, wherever it's happening, it's impacting us as well. Then we saw that what happened with Ukraine and Poland, and we heard that there are refugees, but then there are refugees. So we are also have the added layer of the Islamophobia, of this racism, of the, we are also have to dispel that. So there's just so multi-layered complexity in this, but that said and done, we as healers or caretakers, we need to be cognizant of this trauma, how it's constantly impacting and chipping on us as well. So I would request Hadia, come back. Let's do a deep breathing exercise here with everyone, because this topic always leaves me very raw and disturbed. And I think we should all take a moment to take a deep breath together. So I will request all of you, close your eyes, focus on your breathing, and you can come to the mic. Very simple one, yes, but let's do it. Okay.
So slowly I want you to put please one hand on here and one on your stomach. And we're gonna try to breathe deeply, and we're gonna feel your stomach really getting bigger. Okay, close your eyes and let's think about Allah's blessings who brought us here. Alhamdulillah for this space. Alhamdulillah for these efforts and people. We're always supporting each other. So take a deep breath by the count of 5. So 1, 2, 3, 4, 5, and hold it. And exhale slowly. Try to focus when you're exhaling anything negative that's bothering you, any negative energy, any thought of anything distressing. Let's just let it out. Let's gonna do this again. I'm not gonna talk now. So inhale slowly and you hold it for a count of 4, and then you exhale. So the idea is just like slowly hold it and slowly exhale. Okay, let's do it again together. Hold. And exhale. One last time. Thank you so much.
Thank you so much. We will open up for questions.
Anyone have questions in the audience? We passed up some cards. If you need some more, we can give it to you.
I have a question. I just wanted to thank our speaker that's here today because I met her earlier and I'm going to be very transparent. I asked her, she said I came during the time, and I'm like, for you, are you a refugee? And she looked at me and said I came right before this all happened. And I just froze inside because I should have been more mindful of what I was thinking or what I was asking, and I just wanted to thank you for really expressing, and I hear it when you're talking, and I really commend you for it. Because I was born and raised in the U.S., but I'm a firm believer of my roots are from the Middle East, and I don't want to lose that, especially with my children. And it's so hard when we're doing things because we are blessed, and then we see what's happening overseas.
Well, thank you very much, but I want to say actually, maybe I shouldn't have paused, because this pause, that means I'm thinking, am I, why is this still stopping? You know, my point of when I talk about advocacy is really we need to reach a point where we don't have any reaction, right? You know, and I think.
Yeah, I think it's okay to be human. It's okay to be human in these conversations. I think that's a important factor. What I have to say is that we have to understand our own, what we should follow, the burden we hold when we're doing this work. I appreciate it. I couldn't, I was like so proud of it.
Common. Any other questions? Yeah, please go ahead.
The question is for Dr. Zarzour.
Dr.
I think when you talk about resilience, is there any aspect of Islam that you utilize in your
Yeah, definitely. I mean, like even let's say the same in the program. Sorry,
in general in the program, whenever you have any aspect of Islam that you particularly care about.
Yeah. I mean, Islam, faith gives us meaning, right? Meaning and purpose, and that's huge when it comes to therapy. And that's actually we see it a lot after COVID now. What's insecure, where I don't know what's happening. I work with non-Muslims as well, so I see this a lot of like how we understand things. So I focus on the idea that Allah is in control. We know there's faith. And the idea of, for example, some concepts as actually very interesting ayah that I knew when I was a child, but nobody really explained it to me that way. So I'm just going to say it in Arabic. This idea that Allah uses, that we're going to rescue with fear and poverty and loss of people and loss of money. The interesting part is that Allah subhanahu wa ta'ala shows the word as a test. The very first thing that he shows is the cause, which is like fear, whether it's fear, worry, stress, whatever you want to call it, as the very first thing. And it can't be coincidence. So what does that tell us? People who are really struggling with those things, we help them, of course we're giving them tools to cope, but at the same time we're telling them this is a challenge and it's a test. So it's like when someone has cancer, yes, they go for treatment and they try to do whatever they can do, but still they feel like, yeah, I'm connected to Allah because it's a test, and inshallah I'm rewarded for it. So when we think about also psychological feelings at the same way, it's actually beautiful and can help you really cope. So, and also the idea of the idea that hardship comes ease. So all those families that I work with, it's beautiful when you ask them about sources of strength. And they say, there was this person who helped me. There was my mom that I remember her voice in my ear. Sometimes, so I would say with like, when you go through hardship, I tell them, let's look, what's the ease around us that we don't see it? So try to pay attention to, because the ease is definitely there. Like when I'm here, like if I'm struggling, I would say, Dr. Abbasi is absolutely one of my ease factors. Because, honestly, it's hard to say that because you're here and now how are you going to believe it? I'm not really trying to be nice.
But there are people who really anchor me. She brought me into this. Like when I feel like I'm really connected. I was really very like emotional this morning, and I was like, when I'm saying I feel home, being here connects us as Muslims, as therapists. It can be very. I've been here for 14 years, but it can be very isolating. So the idea of like, what's the ease factors? We need to look for them. And the last thing, Allah will give you what you can't bear. That which means when He gave you something which you can deal with. Even when we talk about those references, I always think like, yes, I think that it's difficult, but then there must be some things that we don't see. Look at my cousin was in prison for some time. He was tortured at the beginning of the revolution, and that's actually the main reason I didn't go on. I was scared. He was talking about this connection with Allah when he was alone in his cell. And I was like, wow, so there are things that we don't see, but we need to look for them and highlight them and stress them for people so they can hold on to them.
I would like to add one important piece to it, but thank you so much. So in therapy, we say focus on what's working and take their focus away from what's not working, right? But when we talk about spirituality and using Quranic verses, we have to make sure that we as a community are also accepting, validating, and giving them the sense of belonging. Because one thing is Quranic verses, spirituality, that helps. But sometimes when we take them to the community, to the Islamic center, we do have innate racism. We also have our issues. So other thing because from this work, I also work in the field of intimate partner violence and domestic violence, right? So sometimes, unfortunately, this religion can be twisted with the culture and used for intimate partner violence, right? So we have to be very clear. Yes, Alhamdulillah, we have a big tool in form of Quranic verses, but we as a community also have a responsibility to continue to work on ourselves to become inclusive, validating, that we become safe spaces for these vulnerable populations.
Can I add just one thing? Quickly, because as the same point, guilt comes a lot from religious figures. This idea of guilt is huge. So what we do, we ask. First, of course, all of these, I answered this because assuming that this person really works with them, as Dr. Abbasi said. So that's all there are certain questions that we ask to know where is the person. Because if someone really thinks like, why did Allah do this to me? Of course I can tell them, okay, there's this ayah. All of what I said really